It's open enrollment season, and that time of year when most people are signing up for their annual health care coverage at work.
But making the right choice for coverage is not always easy. Carolyn Clifford is here now to help make the process a little easier for you. Carolyn?
You know, this is a big deal for a lot of people, and we're all in the same rocky boat. In fact, some people are totally confused about what's best for them as individuals or for their families when it comes to health coverage. Are you pulling your hair out as you sit down and try to sign up for your health care coverage at work? Was that your first time going through the process?
It was.
What was it like?
I don't even know what I signed up for.
22-year-old Melody Camaro is, like a lot of people in Metro Detroit, confused about open enrollment.
It's really important to make your elections this year with all of the benefit changes that we're making.
If you're lucky, a company expert will walk you through your options.
Oftentimes an HR department for a large organization will provide some of that information. Some of it may be information you will understand, and oftentimes you can't make heads or tails of it.
Scott Ethorn is a family physician with Ascension Providence. He's also the president and CEO of Together Health Network.
It really starts with understanding what your needs are. Whether as an individual, part of a family.
For Melody, she needs individual coverage and wants to know
My deductibles, my co-pays, what's best fits for me.
a lot of people are being offered high deductible plans today. More of the cost is passed on to employees. Ethorn says, consider 3 important things when picking your health care plan. Number 1, are you generally healthy and only go in for your annual checkup, preventive health services, or minor ailments? Number 2, do you anticipate a lot of expenses from surgery or if a family member has been ill?
If there are any conditions that are chronic conditions that might lead to more frequent care, you're really going to want to make sure that those services are covered.
And 3, consider your copay price. For instance, if your company will pay 80% and you pay 20%, does that really work for your budget?
Complexity of these plans is significant, and that's why it's so important to spend the time to really understand what those benefits are.
Other options: flexible spending versus health savings account. The first must be used within a year on qualifying expenses, whereas health savings,
Accounts that you can think of as a savings plan for the future.
the money rolls over year to year, and if you change jobs, it goes with you.
It's smart either way to save money and have money in the bank to cover health care costs. We know that it's a leading cause of personal bankruptcies.
Rachel Adams is 26 and works at a child care facility with no company health care. Her question?
What kind of health care is affordable but dependable? And how can I find it? How do I sign up for it?
There is a market exchange. Go to healthcare.gov, create an account. It will walk you through the steps for a variety of plans, bronze, silver, or gold, and decide what works for you. Sign up will end on December 15th. Gabal Shah has no insurance as a college student. If he were to get hurt,
Go to an urgent care to get it fixed, but in terms of payments and the way I would pay for it, probably just talk to a hospital or like the staff there and have them direct me.
Ethorn says not a bad idea, but for those who really can't afford health insurance and land in the emergency room over and over again, help is available.
They may be services that are offered by a hospital or some other health provider in the spirit of a community health fair, where they may do some certain screening events.
So for Melody and so many others, you're going through the process right now. That's exactly why we're doing this story. Right? Still confused? If you're employed, your HR or benefits department should help you. Online, of course, go to healthcare.gov, and there are always community resources if you just can't afford health coverage. You can find all of this information and more at WXYZ.com. And I tell you what, I did a lot of research for this story, and I was confused signing up for our own health coverage, and I learned a few things.
And there are deadlines typically associated with that, and if you don't sign up by the deadline,
You're out of luck.
You're out of luck.
Yeah.
So take the time. Don't procrastinate, in other words, like so many of us do, right? Because it's so important.
And do your research, because it really can save you a lot of money.